Hey, welcome to this third distinguished lecture of WISP. It's my pleasure to introduce Bart Preneel. Bart is a professor at the KU Leuven in Belgium, where he heads the COSIX research group. So Bart is, of course, an extremely prolific researcher with main focus on symmetric cryptography, but more recently, he also focuses on, let's say, post-Snowden cryptography. I mean, some of you might have seen his really memorable invited talk at Eurocrypt in Vienna 4 years ago, which is still online if you want to see it. Also, many of us know Bart, of course, as a long-term president of the IACR, which he was, and also to his many initiatives, in particular standardization initiatives like NESI, but also his kind of many efforts to bring cryptography actually to practice. And he will tell us about one such effort, concretely about privacy-preserving contact tracing apps. So yes, Bart, great to have you here.
Good to be here. It would be more fun to be in Vienna, but to have a Zachar talk afterward, I guess that will be for later this year or next year or so. So yeah, I decided to talk about this topic, although it's not very technical. There is not much cryptography technology in there, although I think there is some very cute ideas in contact tracing. We're doing much more technical work as well on blockchain and on white box crypto and ASIC-based encryption and so on. But so I thought I'd speak after 1 year, more or less working with contact tracing about our experiences. And I think there are maybe some lessons for researchers what to do in the future. And I will also end with some problems or debates that are still flaring up today, so you can still get involved and be involved in the discussions. So I'll first look at the big data and Corona, then I'll focus on the contact tracing a bit in detail, but not much. This is, I assume that most of you have figured out how it works, but I'll do it very high level. Look at the evaluation, how difficult this is, and then what the debate is for the future. So I guess many of us about a year ago saw this epidemic coming. We first didn't believe it, and then we realized it was there. And then we thought, okay, so the biggest one we had was 100 years ago was the Spanish flu, and then we got a few smaller ones. So clearly we're much better off now because we have technology, right? We as scientists, we're gonna control this and all the things which were painful and difficult, which meant that the Spanish flu had 3 waves, and in some places 4 waves, I believe. So we're gonna all have this under control with technology, though this is a lifesaver. So at least we can inform people much better. A lot of self-diagnosis. I don't know whether you saw this tool, but I think several universities developed a tool where you could cough to the microphone of your smartphone, and then this tool would tell you whether or not you had COVID. I've never seen it working. I don't know if in the end they made it work, but I mean, this is what scientists do. They have ideas, they have tools, but they're looking with their hammers for nails to hit. Of course, you can collect medical data. You can do this in a proper way, but you can also do this like the Robert Koch Institute in Germany. They spread out a tool to collect data from Fitbits and the like, and then more or less this tool collected all the login data and then just sucked out all the data out of the system, so it was not very privacy friendly. And then of course these pandemics tend to infect people close to us, but the idea was we should use location-based techniques, smartphones, GPS, Bluetooth, to actually find out who was close to whom, and this is how we will be able to control the pandemic as well. So there was lots of ideas, and I guess it's interesting to see how many actually worked afterwards. Maybe interesting reflection as well is that instead of information, we got lots of misinformation as well, right? I mean, this is a separate area of research, but somehow we can build the scientist tools for information, but detecting misinformation there or preventing those systems from spreading misinformation seems to be very tricky. So we got the example from Asia. In Asia, they were much more alert for pandemics because they had SARS before and the Hong Kong flu. So in about a year ago in South Korea, out of the top 10 apps in the Google Play Store, 5 were coronavirus related. Also, China had many apps, mandatory apps in some cities. From our perspective, China is very monolithic, but in practice, there were hundreds of apps in China as well. Every city had their own app. The most famous story about these apps was a Korean app. There was a Korean app that if you were infected, it would actually publish your location trace. So it would actually give in the morning, this person was there. In the afternoon, he or she went to have a coffee there. Then he or she picked up their kids from school there, and then they went to whatever, play tennis over there, and then they went back home. And of course, these traces were officially anonymized, but we all understand that this is actually not very private. And so people were de-anonymized. And of course, especially in the beginning of pandemic, people with the virus were stigmatized. So this actually was a horrible thing. But of course, we said in Europe, it's never going to happen to us because we have GDPR. We're never going to do these kind of things. So what can you do with technology, and in particular, our smartphones? You can, of course, surveil people because you know where they are. And I believe this has been done in part in Italy, where the virus hit very heavily. So people were told not to leave their house or not more than a certain distance. And of course, your cell phone can be used to locate you using triangulation techniques because there is multiple towers. And it's not very accurate, but it's good enough to more or less determine where you are. And so this can be used as a surveillance system. We all carry our smartphones. And in fact, you could find out where people are, and you could even go to people who broke the rules, because you can actually do this at large scale with mass surveillance in real time, more or less. You know who is actually leaving their house without permission. A bit more benign is crowd detection. Google provides mobility data, and also in several countries, including in Belgium, there was movement between zip codes detected, based again on mobile phone traffic data. In Belgium, I know that they only released data between 2 zip codes if the number of travelers was at least 30, so they have a kind of anonymity set. And so there was some way of aggregating the data. It was not so sensitive. So this can be used to find out whether people move more and whether lockdown works. And of course, you can also find out whether things are crowded somewhere. But you may also have seen this artist in Berlin who took a small wagon and filled it with old phones and then drove around. And then Google thought that actually all the streets were jammed with big traffic jams because the phones were moving very slowly to those streets. So this, of course, is not very secure, as cryptographers will look at this in kind of disbelief, but it has actually worked as a tool. It's still being used, for example, in Belgium to estimate how many people work at home and how many actually go to the office. And then what we talk about today is proximity tracing. So can you find out who was close to whom? And so can we use this to actually do contact tracing? I guess after here, I don't have to recommend contact tracing anymore. So you have to find out who was in contact with an infected person. And the difficulty with COVID is that people can be asymptomatic. And even if they become asymptomatic, they can be temporarily asymptomatic. And so if you only isolate people with the symptoms, you always come too late, because in the pre-symptomatic phase, they've actually already infected other people. So in fact, if you find somebody who tests positive, who has symptoms, you have to go back in time a couple of days, find all their contacts and quarantine those. So the person itself is isolated, the contacts are quarantined, and that's the only way to actually stay ahead. And this is necessary. So of course, you not only have to find those people, you also have to convince them they should actually quarantine, they have to stick to the rules. In some sense, if you could do this perfectly, if you have enough testing capacity, if everybody would collaborate and everybody would quarantine, you would actually probably control the pandemic. But of course, in practice, people don't always comply, and you can't do this perfectly. And there is also asymptomatic cases which we never identify. So here's a graph I think it's interesting if you're not involved with this. So because now I'm involved in Belgium, I see this, I'm in these meetings every week, or it's twice a week, where we discuss these things. So contact tracing is a skill I think society had forgotten about. Of course, it was used 100 years ago. But in Belgium, there were still a few dozen people doing this for people with tuberculosis. But of course, they were dealing with a few cases per week, and they were visiting them and talking to their talking to the people, talking to their contacts. So it was all very manual. And also for TB, there is no rush. Well, here, of course, suddenly you get thousands of cases per day, and this is not going to work to visit all of them and talk to them and then go visit their friends and talk to them as well. So what you see here is the curve that tells you how much time is wasted spent between beginning of symptoms and in fact somebody is being called to give their contacts. And so the dark green is the number of days people wait. So as you see, on average, it's about 2 before they actually get tested. So people usually wait 2 days. And so as you see, we failed since September to reduce this. Even today, in spite of all the efforts, people still wait 2 days before they get tested. And in Belgium, there is now enough testing capacity. The capacity is about 120K per day, but the number of tests is about 40 to 50K per day. But you never have to wait for a test. You can get tested very easily. But in spite of this, people still wait 2 days. And then the lighter green is how long it takes you to get the result. And there you see some substantial effort has been made to reduce this, especially the testing is now much faster. We had a second wave in October, which is when you see this peak, and of course then there were bigger delays, but today in fact test results are there within a day, 90% within 24 hours. And then reaching the index case, we can reach now 88% within 48 hours. And then of the high risk contacts, again, 91% are reached within 48 hours. So you see that there has been quite some effort to create this system. It has been blood, sweat, and tears. It's much harder than you think, because it's of course not only IT, it's also training people, it's educating users. But so the bottom line is now that, in fact, to make progress, you have to convince people to get tested faster. That's the only way you can make progress. And so you see that, in fact, technology doesn't play a very big role here, right? Of course, there was technology delays and delays in having enough people in the call center and a performant call center. But that took several months to fix, although I mean, the design started in April, the first rollout was in May, the system started working properly over the summer. But then you see that actually it only got trained properly, was really optimally tuned in November. So that tells you something about real life systems. It's very tricky to do. So the idea was very early on to complement manual contact tracing, because manual tracing is very privacy invasive. People don't like to be called and asked about their contacts. It's kind of slow in the sense that you're also always speaking of at least a day, and then to reach the contact another day. So it can also be several days. It's expensive. So I know Flanders, this is 6 million people, so this is a bit smaller than Austria, has spent so far in the last year about 55 million euro on manual contact tracing. So it's a lot of money. So there is about 1,000 people working on this permanently. So per day it costs between €500,000 and €250,000. Compared to the cost of the pandemic, is still very cheap, but it's a lot of money, right? If you look at it, what you spent on it. And of course, people, some people don't want to give contacts, and some people are not able to give contacts because maybe they don't know the name, or you sat next to somebody on a bus or a train, so you will actually not be able to give that name. So that was the idea about a year ago. People said, let's use apps for this. With privacy by design, it can be faster, should be able to work within 12 to 18 hours. And hopefully we can make it accurate enough. That was the idea. Of course, both should coexist. I think this idea of technology is that we could supplant manual contact tracing, or some people made this claim. I think is of course completely outrageous. You can't, because some people don't have the app, and the app may not always work perfectly and so on. So you always need both in any case. I think that was a myth. The problem was, of course, that in February and March, there were lots of 5-person companies who hacked some code together based on GPS or something else. A privacy nightmare very often, also not very accurate, but they say, we have a working solution, and they went to the government and say, give us a few million, we will roll this out, and then you don't need manual contact tracing, which was, of course, didn't help. You can't use GPS because first, GPS is not very accurate. So it's 1.5 meters is the accuracy of the standard GPS. And second point is that there is this paper by some of my colleagues of Louvain-la-Neuve who showed in 2013 that if you have 4 space-time points, then you can identify 95% of individuals uniquely. So if you use location, as most medical professionals wanted, because they wanted to find out where people got infected, you're actually never going to get privacy. Even if you remove the name, people will be uniquely identifiable. In spite of this, so South Korea used location, Israel did. You may know that in Israel, they also use Mossad because they're very good at spying on people, and they had a very good technology to find out contacts. And then they also asked for Google for help. And also Norway had an app which used location data. Of course, privacy researchers and security people, we warned the government that if you build such a system and if you automate it, it will be abused. It's kind of lots of stories have happened since then. For example, in the UK, the police went to the manual contact tracing and asked for their data, either to give them a fine if they don't comply, or maybe to also solve some other crimes that happened in certain neighborhoods. So all these things that privacy activists predicted actually happened. In Singapore, the police went to ask for the data. In Australia, the intelligence agencies. And this is about, the bottom quote is about presence detection. So in the bar, of course, you have to give your name there. And then, of course, the barman then used this to contact some people afterwards with some indecent proposals. All these things we actually predicted more or less happened. If you collect this data, it will be abused by several parties. The most extreme case happened in Norway. In Norway, the privacy authority looked at the app and told the government to stop it. So this happened in June. And then in the end, what Norway did is they had a big fight, an argument and debate. And more or less in December, they decided to use the Danish app, which they got rolling out in January. So they lost actually 6 months by first quickly rolling something out, which is not acceptable. I think in Austria, something similar happened, that there was this Red Cross app very quickly, and then people published a study, it was not as good, and then a new version was produced. And then in the end, they switched to the DP3T solution. But of course, at that time, many people have lost confidence in the app. So it's not only about technology, it's also about confidence. So this was what we set out to do. So the group led by Camila Troncoso, one of my old students, is now professor in EPFL. She brought together some people. And we wanted to have such an app with privacy by design, so data minimization. We didn't want social graphs, we didn't want locations. We only want the tool to be usable to detect proximity and nothing else, because we were worried about function creep, that this will be used for other things. This was a big clash with some medical professionals who insisted that they had to have location, because otherwise they would not be able to control the pandemic. Our point of view was that this would lead to privacy violations and people would not use an app. And that if you want to do cluster tracing, you should just ask the people. Because, you know, if people have been in schools or in bars, in general, especially it's professional environment, schools, you can find out, right? People are not going to deny or hide that they've been in the school. For bars, it's a bit more delicate, of course. So you don't want to, of course, find out who's been in contact with whom and when. So you don't want to find out who infected you. It should not be possible to discover this. And you also want the system to be auto-fading, so that in fact, if the pandemic is over, that all this data disappears very quickly. Should be sufficiently accurate. And there was a lot of debate about this. I'll show you some numbers. In the end, I think accuracy is a bit of a red herring. That's not the main problem. You should also have security. So you should avoid false or incorrect reporting. In most countries in Europe, if you test positive, you call a number and you get a code, you enter it in your app, and then you can share your keys, you can report your infection. So of course, nothing would stop you from entering this code in a different phone, because nobody checks. And in some countries, it's very hard to check whether somebody really had a positive test or not. In Belgium, this is tied to the app, but of course, it made the system a bit more complex. And in retrospect, I'm not sure. I still have mixed feelings whether it was the right decision or not. Right? But of course, but Belgians are a bit more anarchistic and a bit less compliant than I would say the Swiss or the Germans. So I thought that the approach they chose was a bit too optimistic. System should be scalable to 100 million users. We wanted everything to be open. So specs and the software should be voluntary, because if you force such a thing, it's never going to be used, or people will have two phones, people will switch off their phone, or people will not Bluetooth, or they put their phone in a metal box and so on. So people have to use it voluntarily. And of course, we wanted to be fast. So this was a plan we made in March. We wanted to be ready by end of April. In the end, the first demos were done end of May, and the rollout was in the first countries in June. Belgium was only rolled out in September because there was a lot of political bickering about whether we should have such an app or not. And I think Austria had 3 versions, if I'm not mistaken. So they were very fast with the first version, like the Norwegians, and then they had to retract and come with a new version. It became very quickly clear that we will not be able to make a working app quickly without Google and Apple collaborating, because especially Apple controls what's happening on the phone. And if your app is not active, it puts it asleep. Also on Android, especially on the phones that are cheaper with smaller batteries, there is a very aggressive battery management. So this app is normally there all the time in the background, but it's not used by the user. So ideally, you don't open it at all. So the phones detect these kind of apps and they kill them. Of course, then you have no contact tracing anymore. On iOS, you can't use Bluetooth. You can't send Bluetooth beacons in the background. So you have to have the app open in the foreground, and you can't have your phone locked. So it's very inconvenient. You have to have your phone unlocked all the time in your pocket with the app in the foreground. So there were some companies that said they had workarounds, but I've never seen any good workaround. Google and Apple also, of course, insisted on battery minimization, so that you don't send many things. You listen only every 5 minutes, and you send only every 100 milliseconds. So they actually had very tight requirements. In practice, it turns out on Android, you still see an increased battery consumption because Google requires you to activate location services. And don't ask me for what reason. It's a legacy decision because Bluetooth was part of location people in buildings that they were selling access tokens or Bluetooth nodes to spread in buildings. So typically shops or shopping malls, so that users could be traced. And for this, Bluetooth was part of location services. So if you want to use this interface that Google and Apple built, you have to have location services on Android phones on. And of course, now the other apps now see location services and they start consuming more battery because they start using those things. So this is kind of this very unfortunate realities you have to confront. So the problem is solved in Android 11, but I guess that's only 10% of the market or so. So it was a very big legacy problem. And so there was quite some talk between our team and Google and Apple, and I guess also some other groups. In the end, Google and Apple implemented something very close to our design. Overall, there was a lot of work being done, both talking to epidemiologists, what was needed, what should be a high-risk contact. There was quite some work on the cryptography and the protocol. There was quite some fights also about what should the parameters be and how much battery can we consume, how many bits can we send, and so on. There was quite some testing being done, how good does this work? So overall, I think it's very hard to estimate, but I think there were probably, if you add everybody up, there were hundreds of people working on this for months. So it was not something you can do with 5 people in your garage. It was a major effort. And then because in the US, no state deployed the app, Apple, and a bit later, Google deployed their own app called Exposure Notification Express. So they actually rolled out a full app. So what they do in general is provide an API, so an interface that actually does most of the work. Excuse me, that sets most of the parameters. So in the end, Google and Apple made the call. Also very interestingly, in the privacy debate, especially Google is not always on the side of the user. Apple tries to be more. So Google and Apple say, if you want to use this API, it can only be one per country or per region, and you cannot use location services. So you can't use collect location. Even Germany uses the camera. They have to get special permission. So in general, Google and Apple say we want to have this app, or we want to support this app. We have a special interface that makes it work in the background, that makes it work with low battery, that makes sure it doesn't go asleep. We will support this app with an API, but then your app has to be approved by us. And it cannot use location services. It cannot collect certain data. You can only call the interface so many times per 24 hours and so on and so on. So they put in many reasons. So very interestingly, some countries like France, they wanted to collect much more information. And then Google and Apple said, in that case, you actually don't get access to our interface. It was very interesting that in the privacy debate, normally it's the governments that are fighting with Google and Apple and saying, what you're doing is unacceptable. So here we saw the opposite, Google and Apple telling governments, if you want to do contact tracing, you should actually protect the user's privacy. And what you want to do is not acceptable. So a very strange position to be in, because if you wanted to push this app, you were actually suddenly on the side of Google and Apple in the privacy debate, which is a strange place to be. So there was a team put together by Carmela in March, so a year ago. There were similar initiatives in the US called PACT. There were 2 PACTs in the US. So there were lots of talk with Google and Apple. In the end, they settled on an interface in April. They released their drafts in April and May. And then the first test apps were running already in April, but the final interface was only in May. And then the first countries who launched the app based on this Google Apple interface was in June. And then at the same time, Europe started working in interoperability, and that took till October before it launches. So since then, the same principle has been deployed in a number of states in the US with limited success, also in some countries in South America and some countries in Asia. You can follow at this link if you want to find out who's actually using this app. So a few things. In Belgium, there was a long debate. I will not bother you with Belgian politics, but maybe just for the fun, Belgium has 8.5 ministers of health. So this was a very long debate before these 8.5 ministers could even agree to have such an app or not. And the only thing I tried to do to avoid backstabbing and fighting and was be very transparent. So all documents, all the memos sent to the ministers, the call for tender for the company that had to write the app. We had a public consultation, we have a design document, data protection impact assessment, our code, everything is public. And we spent quite some time documenting the whole process to actually make sure that we show we have nothing up our sleeves. I think it was also very important to get some support, to have full transparency, which we didn't see in all the countries. For example, there's still some countries in the EU that had such an app without making their code public, which I don't think is a very good idea. So for those of you who still don't know how it works, it's actually very simple. You install the app. Every day the app makes a key called a temporary exposure key. And based on this key, it makes a number of rolling codes, rolling proximity identifiers. And these codes are changed together with the MAC address of Bluetooth or PLE. And so every time you make a new MAC address, a new code is being sent out, and this code is broadcasted every 100 to 200 milliseconds. It's a very short code of 256 bits. And then what also happens is that every 5 minutes, the phone listens for a while and stores the codes received together with single strength. And so this 256-bit block, in fact, consists of two parts. One is a random code, and the second one is a ciphertext that actually encrypts some information on the phone that sends, because it turns out that different phones transmit at different signal strengths. For example, iPhones have much louder Bluetooth than Android phones. So if you want to estimate the distance, you have to know what the transmission power was, and this is sent in encrypted form. Also, you have to know the phone model, because every phone has different antennas. And so it's all technical details which are hidden in these codes. But so in general, of course, this is ciphertext, so you can't read this, and these codes don't identify you. So if you get sick, you get tested, and then you get the result is positive, you will upload these keys, one per day, in a central database. And then every phone, a few times per day, will download all the keys. I've only taken one, but so in Belgium, we're now at about 1,000 keys per day are downloaded into the phone. And then what the phones will do is they will actually, from these keys, they can recompute all the codes that these keys ever could have computed or produced. And then they match this with the keys in storage. This is all happening behind the Apple interface. So as a user or as a developer, you don't have access to the detailed calculation. But so if they find that you have been close enough to an infected phone, your phone will show a red screen and give an alert. That's more or less what's happening. So in this check process, all the rolling codes are generated. The second field is decrypted to get the signal strength. And then from this, you try to estimate the distance. And then you try to, from a number of those cases, you try to estimate the duration. And there is some very magic formulas that every country uses to, from all of this computer risk, and to decide yes or no, you're at risk. So the nominal rule is still 15 minutes, 1.5 meters. It may change with the British variant. They're still debating this, whether we should actually now decrease this to 10 minutes or 5 minutes for 1.5 meters. So I will not spend too much time on the Belgian protocol, but this is what I spent my time on in April and March, and also trying to compare all the options. So in Belgium, it's a bit more complex in the sense that in the other countries, once you test positive, you call a number, you get a code of 8 digits or 6 digits, and then you enter this in your phone, and this will be used to authorize this upload. Of course, you want to prevent that anybody can upload their keys. So in most countries, you get a code that's valid for 15 minutes to upload your keys. And it's just a 6-digit code or 8-digit code. And as I said, you don't know in which phone people enter this. And it's also not always possible to determine whether somebody actually tested positive. So in Belgium, we actually link the phone and the app in an anonymous way with a commitment to the test result. It's a bit complicated, so I'll give you the high-level story. So more or less, the doctor decides the time of onset of symptoms. This is something hopefully the doctor can help you determine. And this is entered in the app, and then the app produces some random number R0 and a key. And then it actually spits out a commitment to that random number, which is 15 digits. The system also takes your national number, your health insurance number, and your mobile number. But this is in green. This is more or less a different database system than the app. The app just takes a date and this code of 15 digits. And then this all enters in a central database. So in Belgium, there is a central database where all test results are collected. This, of course, this database didn't exist in April last year. It was created in April. And it's also used as the basis for manual contact tracing. So in any way, you need such a database because for manual contact tracing, you have to know people's names and phone numbers so you can call them, or email so you can reach them. So this is kind of unavoidable that you have a list of people with test results. So the app data resides in there for a very short time. As soon as the test result arrives, all the app data is erased from this database, is sent to a separate database that just has this random code, the date of onset of symptoms, and also the test result. And so it doesn't have any identifying information anymore. So of course, here we have some audit process, some trust that nobody ever links this code R1 to your national number. But of course, the people here, even if they look at this, they don't know, of course, to whom. I mean, they don't have, typically, they don't have signals with R1. They have never seen R1, and they don't know how to link R1 to a key at this stage. This is completely independent anyway. So once you got tested, so you push this button here to generate this code, your phone will every hour start asking for the result. And if the result comes, it will actually get the result. And then this server here will upload a signature to the central server that authorizes this R1 to pick up a key. And the phone releases R0 to actually prove that it actually is the phone that corresponds to this positive test result and to this commitment made in the first place. And so the database can check indeed that this R0 and this key actually correspond to the R1 value, which is signed. And this is how the match is being made. So you can't upload keys from a different phone as the one you used at the doctor's office before. So more or less, this is one of the 17 variants of the protocol I proposed, the one that was eventually implemented. So I talked to many doctors before, and in the end, the doctor said, this is too complicated. We don't want to fill in 15-digit numbers from phones. So then we made a different solution where people get an SMS with a link. And then in this SMS, they get the data from the app, and the users only enter their national number. And based on this, it goes to the central database as well. This is the fallback we implemented, I think, after about 6 weeks, when the doctors told us, I mean, I spoke to a lot of doctor organizations and to their managers and so on. They said, this is fine. And the doctors just say, go to hell. I'm so busy. I'm not going to enter a 15-digit number in my system. So they have to, for every test, they have to fill in a form with the patient data. But this 15-digit number for many doctors, this was kind of completely unacceptable. So that's the reality of life. Then we had to find out another way to do this. So I guess you've seen that the app shows you low risk and high risk. In Belgium, it was decided that also the app shows you details about the low risk. So for example, when I was teaching in October, I had classes of about 50 to 60 students. So every time after a lecture, I got a warning a few days later that I had a low risk contact. Why? Because probably one of the students tested positive, but because I was in the front and they were like 5 or 10 meters from me during 2 hours, this was decided to be a low risk contact, so I didn't get a red screen. But I kind of found out that probably some of my students were positive. And I asked how many students had the app. At that time in my class, about 95% of the students had the app. So it was actually pretty popular. I don't think it was only in my class. The students in general liked the app. So protocol was rolled out in many countries. At this moment, my estimate, if you take EU plus England, Wales, Scotland, Northern Ireland, Switzerland, Norway, we are close. We're getting very close to 100 million downloads. Numbers of users, this is probably lower. I think it's probably something around 40 to 45 million. So we don't know how many users there are because in principle, you don't know what's happening inside the app. Download rates vary. The highest is Finland and Ireland, about 50%. Germany, Netherlands, Denmark, they get close to 30%. Belgium is in the group, it's above 20%. I think Austria is around 15% last time I looked. of downloads, which means 7% of users. And then in green, you see France and Hungary, they have a centralized solution, which I will come back later. So the nice thing about this protocol is that it's very easy to link all databases together. And so you can exchange between the countries all the keys. Because these keys anyway, they're not so sensitive data. The lawyers say they're not random data and anonymous data, they're pseudonymous data. But in fact, to link a person to a key, you have to do a kind of an attack where you have a Bluetooth antenna and a camera. And so it's possible, but you cannot do it on a large scale. It's kind of tricky. So you can just exchange these keys between countries. And this is more or less what's happening. Many smaller countries would have preferred that you would only send your keys to a country if the user told you that he had been to that country. But Germany said, we're never going to ask our users where they are. So Germany says we will consider Europe as one big country. So now we had not much choice because Germany generates most of the keys anyway. So all the countries had to adopt the One Europe option, which means that virtually the app works as one single app in Europe. So every night or every 6 hours, all the countries share their keys. And so whether a German comes to Vienna and if he later goes back to Germany, tests positive and you were close to this person, you will get a warning. And vice versa, as an Austrian, if you travel to Austria, you will get warnings also from German people around you. What you still cannot do is, as an Austrian, if you get tested in Germany, you cannot enter the test result in the Austrian app. So the health systems are still completely separate. But at least it's, especially people who work across the border, it's very convenient. They can use one app that works in multiple countries. So there is now 14 countries hooked up and 4 on the waiting list. I think this map is not up to date. I think Slovenia joined recently and Portugal as well. And also Norway, I think they're part of the server. Switzerland is not allowed because Switzerland refuses to implement one law, one directive. And then as a punishment, the Commission forbids Switzerland to connect to this server. So there's kind of a big fight happening there. Germany is now talking to Switzerland to make their own interchange of keys. Okay, so does this work? So in April, Oxford released a study which claimed to have said that you need 60% deployment for this app to work. And of course, this is something politicians remembered. So for many politicians, it was an excuse to not have the app because you will never reach 60%. And they were right in one thing, nobody has achieved 60%. Even Finland, I think, is at 52% downloads. But since then, there is newer research that actually says, well, this model was not very realistic. Just no manual tracing. The current research says that what's interesting is the graph here in the middle. I don't know where you can see my mouse, but so the red curve is app only. The black curve in the middle is manual tracing only. And then the blue curve is the combination of the two. And so more or less, you can see that the detection ratio goes up as soon as you have the threshold of about even 10% or 20%, you detect newer cases. In the Netherlands, they also did a detailed study. In the Netherlands, they can prove that they found at least 1,900 cases which are not found by manual tracing. You can say this is marginal because we had hundreds of thousands of cases. But of course, you can also argue every case helps and every case saves a life. And also, especially if you get a peak, then we know that manual contact tracing will break down. So if you have another high wave, the app is kind of a defense. I think in Belgium, it actually was ready right on time because the app was released end of September and we got our big wave in October. And so I think it actually helped to identify people. So, but it can also be shown through models. Something which is harder to evaluate is that actually the app is faster. So more or less, I showed you the times of Belgium between warning or between a positive test result and warning people. It still takes 1, 2, sometimes 3 days. And the app can always do it in less than 24 hours. And this is something that is very important because that makes a difference. If you can find people sooner, they will quarantine sooner and they will infect fewer people in the meantime. How about accuracy? People say, look at this graph. This is a graph produced by the EPFL ETH team. So what you show in the x-axis is attenuation of a symbol, and in the y-axis distance. And so the ideal curve is this quadratic curve. For near field, I believe it's quadratic. And so, but the real graph, of course, is all over the place. And so people look at this and say, how this app can never find out whether you're close or not. So these are distances in green lines, is 1.5 meters, 2 meters, 3 meters. So given it's so fuzzy, you can never find any good results. There's a different graph that gives you the same information. It gives you a recall. So this is false negatives and then precision. And so, for example, many apps use a 55 dB threshold. This is the curve for 1.5 meter distance. So you have at this, if you take 55 dB, you have 60% recall. So you miss 40% of the cases, and the precision is only about 50%. So people say, well, this app is useless. I think this is a mistake because, in fact, of course, it's not the case that Corona stops after 1.5 meters, but aerosols are stopped after 1.5 meters. And so you see that, in fact, if you set this threshold, this is the curve for 3 meters. That for 3 meters, your recall still stays very high. It's still 50% of the cases you find. And then your precision is already close to 95%. So in fact, it gives pretty good information. In fact, it's very noisy. And the other thing, what people don't realize is that the attack rate of the coronavirus is 15%, which means that if you sit next to somebody with corona for 1.5 meter, 15 minutes, so it's seen as a high risk event, that only 1 in 7 persons will actually get corona or will be infected. So in fact, manual contact tracing is also highly inaccurate, even if you would know exact distances and exact circumstances. The attack rate is very low, so contact tracing is by definition noisy, and the noise from the Bluetooth measurements are not so relevant. If you're going to improve that, you're not going to really make big gains. And of course, the other problem are super spreaders and the fact that we don't know about ventilation and so on. So in any case, it's going to be a noisy affair. So here is some German numbers, some German experiments. The bottom line there also is accuracy of 79%. It doesn't sound very good, but if you understand that if you do manual contact tracing and you warn 7 people, only 1 of those 7 will actually be infected, right? That's the reality. So and then this 20% error from the app is not really the big problem. It's a very much, for scientists, it's of course horror, but from an engineering point of view, this is the reality on the ground. What you have to do, it's good enough, right? So this argument is not good enough. We need 95%. We don't need 95% to make a difference. We have some Belgium stats. So this is the number of downloads in total. So in Belgium, we're at 2.5 million, which is still not very good, 21% of population. Of course, it's more if you look at population with in the right age range and with the smartphone. And 63% is Google, the rest is Apple. Active users, you can only estimate. How we estimate this? Well, we use a similar technique as Switzerland. I didn't show you many details because there is many details about the app. One detail is, of course, that by looking at who uploads their keys, you actually would be able to find out who tests positive. So for that, or in Belgium also, if you contact the result server, that means, in fact, you probably have undergone a test. And so what we do to hide all these things is we send dummy traffic. So we contact the test server even if you never got a test, and we upload keys even if you never tested positive. And of course, we have to mimic real traffic. It's pretty tricky. But the nice thing is that from this traffic, you can actually estimate what is happening and how many phones are actually still working. It's of course an estimate because it's pretty tricky because a lot of old Android phones go asleep and never do anything. So we don't know whether when they wake up again. And so it's very hard to do measurements. But our estimates say that it's about 55% of the phones that's active. Most countries end up with similar numbers. So the only other country that gives test result in the app, as far as I know, is Germany. So we are at about, so you see the number per week we get in the app. So it's a respectable number, but of course, this is the orange curve. So this is the total number of tests is what we have. And then the ones that end up in the app, I'll show on the next graph, it's better to see there. So this is the orange curve here. And in blue, you have the number of cases. So you see the October peak here. Most tests are negative. This is the gray curve. And then the yellow curve is the number of positive tests in the app. This is where the app actually works. I'll show more details. What you see here is the fraction of tests in the app is about 10%, which is, I think, realistic if you look at the fact that so we have 21% of downloads. We have about a bit more than 10% of active users. Strange enough, the number of index cases in the app is slightly higher. So it seems that people with the app have a higher risk of testing positive. There have been some studies in some countries whether the app makes you reckless, and the indication was so far no. But in Belgium, we still have ongoing studies to find out whether actually having an app makes you behave more dangerously. What you see in gray is, which I find the most disappointing curve, and we're still working to improve that. You see also a glitch when we connect to the European server. We had some problem, and there was also a bug by Google around the same time. So the message is that only 30 to 40% of people with a positive test actually decide to share their keys. This is something which I find really surprising. In Germany, they are 60%. I don't know the numbers for Austria. But in Germany, if you get a positive test, you have to call a number, you get a code of 8 digits, you have to enter it in the app and then upload. Right? In Belgium, if you get a positive test, you just click upload, confirm, and that's it. And still, we see that less than 40% of people do this. So people seem to have second thoughts. So they may not trust the app, or they may be worried, or they may have their thoughts elsewhere. But so we actually lose a lot of possibilities of the app because only 40% of people actually is willing to share their keys. Germany is contemplating a solution or is implementing a solution where you will no longer be asked. If you're positive, they will take your keys, which of course the privacy authorities don't like. So again, these are difficult decisions to make. I'll skip the other details. Maybe this graph I still want to show. It actually shows that the app does correlate with potential infections. So what you see here is positivity rate of tests. So during the our peak in October, it was above 25%. Now it's our positivity rate in population is 5% of tests, although we do about 40 to 50,000 tests per day. But you see the positivity rate for people with a high risk alert is almost twice that of the ones of population. So it seems that actually the high risk alert indeed works, and that if you get a high risk alert, your probability of being positive is twice as high as not being positive. And of course, as you can say, this is ridiculous. But if you look at the attack rate of 1 in 7, it's actually a very good result. We identify people, and we identify positive cases. I think that's the message. But the app doesn't give you random data, because if the app would give you random data, you would never get there. There's been a more detailed study announced, not released, a month ago by England and Wales. So they have 21 million downloads, which is about a third of the population. They do more measurements inside the app. So it turns out that in Ireland and in UK, you can opt in. I think in the UK, I'm not sure you even can opt in. It's done by default. They measure things inside the app. This is also something that now I think Italy and Germany will implement. This is privacy preserving statistics, that the app will actually tell about high risk warnings. I guess in an El Gamal encrypted message, it can then be sent to the server, and then it can be aggregated and then decrypted. They will have some clever way to collect statistics, but the UK and Ireland do it without privacy. They just collect statistics. They look in your app and they find out what's happening. They give very optimistic numbers, between 200,000 and 900,000 infections. I'm not an expert. The numbers have been prevented. Okay, so they also speak of many thousand deaths. I think it's very difficult to make these predictions. Some people claim that they make too long predictions in the future. But in general, I think we've been studying the problem, and I think our conclusion is, this is a paper which has been submitted, which is already on arXiv, is that the evaluation of these apps is very, very tricky, because it's not only a computer science system, there is also a health system behind it, right? It depends on how manual tracing works, how good tests are, how people respond to warnings. So it's a very, very complex ecosystem, and the app is only a very small piece of this ecosystem. It's also why in every country you may end up with different conclusions. In every country may need different measures. So it's a very, very complex system. I think the healthcare system, as a technologist, I guess I knew it was complex, but if you're in the middle of it, you realize how difficult it is, how complex it is, right? It's very hard. It's not just one intervention that can solve this all. So in Singapore and France, Hungary, they have a centralized system, which is the same principles, But in fact, what happens is that everybody stores the received Bluetooth tokens. But actually, what happens is if you're positive, you upload your received tokens, not your key, but your received token, because the government has the key of all the users. So in fact, the government knows who's behind all the Bluetooth tokens. So in fact, you're much more vulnerable to an attack by the government. And also the government can analyze all those things and can find out, for example, who had too many contacts. So they can recover the social graph of people. So you have much more information in the central database. You have the contacts of all the infected people rather than the keys. And so the government, of course, can find out who's behind then this high-risk contact here, and they can warn this person. So the government also knows how many warnings there are because they give them themselves. It's not done locally, it's done centrally. So this is the French Robert system. And so there was a very big fight in April, March, April, because the Germans and the French wanted a centralized system. And so the DP2T people, we did a decentralized system. And so in the end, I guess we can say we won this battle. Is this perfect? Definitely not. And there is still many compromises made. It was a quick and dirty design. It was designed in a few weeks' time. And then in the end, there was also a compromise between what we wanted and what Google and Apple wanted and so on. Contact tracing always leaks information. But of course, there are big benefits. What could be improved? Well, many things could be improved. I looked on ePrint. The last year, there are about 30 papers on contact tracing. So there is many good ideas. As an engineer, I would say replace Bluetooth by ultra-wideband. It's already in some iPhones. It's going to be much more accurate. And there is replay attacks. You can stop those with challenge response or interaction, but in practice, you can't do it. The current Bluetooth radios don't allow this. If you enter a bus with 20 people and you all have to start exchanging development keys, it's just not going to work. Okay, this is, if you can make very nice papers, you can analyze those schemes, but with the current radios, the current phones, if you enter a bus with 20 people and everybody start exchanging development keys, it's not going to work with the current radios and systems we have. You cannot exchange all these keys at once. To stop relay attacks, you need location information, which is of course highly sensitive. Christoph made a very nice proposal with delayed authentication. I think it probably came a few weeks too late because timing was everything, right? All these things had to be done in a very short time. And if Google and Apple once put something in a spec, they're not going to change it anymore unless they really, really need good reasons. Also, I was looking at the paper again. You did a lot of effort to squeeze everything in 128 bits. In the end, Google and Apple decided to send 256 bits, which would make your life a lot easier, right? But of course, these are all decisions that were made under very difficult circumstances. If we could start over, we probably do many things differently, but we couldn't. And of course, some of these protections against attacks create digital evidence. So it's a very complex trade-off as well. I don't want to spend too much time on this. I just want to have a few minutes of look at the future. But if you want to find out about attacks, because then there was a big debate in March and April saying that if you decentralize, you're much more vulnerable to local attacks. If you have a centralized system, in fact, well, you're vulnerable to the government, but in France, the government is good, as we all know, so it doesn't matter. So it's very interesting. I think then the DP2T team did a very good job at looking at all the attacks, and I recommend that you look at those documents. In fact, it turns out that if you look at many attacks, a broad range of attacks, it turns out that the difference between centralized and decentralized, or Bluetooth and no Bluetooth, is not so big. I think that's an important lesson to learn, that the differences are not so big, and many of the systems have attacks. I think also as cryptographers, we have fantastic models for a lot of cryptography, but like this kind of thing where you have the element of location, the element of time, the element of multiple players, in fact, it was all very ad hoc, right? This is still, compared to the analysis we do in cryptographic schemes, this is still, I would say, like cryptography in the 70s, right? So we don't have formal methods to do these kind of things or tools to make sure that we have all the attacks, that we understand all these things fully. But there is still, I think, if you want to look at the long-term problem, this is still something where a lot of work is to be done, but it's a very complex system where you have multiple devices, you have location information, you have relay problems, and so on. So how can we do this? And whether you can implement in practice is a different story. So time to wrap up. So In some sense, I think it's a miracle, because if you look at how IT systems concentrate all the power, and this is in part driven by intelligence services, in part by large corporations that want to create, monetize our data. So it's kind of amazing that we managed to roll out a system that is decentralized. It's kind of, it's surprising. I think it's a success for cryptographers that we managed to do this, or for the security and privacy community. And it's not a major success, because I don't think we've saved millions of lives, but we managed to get a system on something like 100 million smartphones, 50 million use it, and it actually is privacy friendly, and there is no central database where everybody can get all the data. So public acceptance is very important. Apparently in Finland, people are trusting the government and the app more than in Austria. This is interesting. I had a lot of discussion with lawyers in the last year. And so the lawyers, actually, they're not so sure what they want, because they say, we want privacy by design, but you should also prove that your system is effective. Because if you can't prove your system is effective, we can't judge whether it's proportional. So you're going to always process data, and to assess whether what you do is proportional, we have to know how effective it is. But if you look at these privacy-friendly systems, the more privacy-friendly it is, the harder it's to prove it's effective. I mean, the French know exactly how many people they've warned, because the government sends the warnings. In Belgium or in Germany, in fact, we only have indirect evidence of people getting red screens. So it's very interesting that we now are in a fight with our privacy authority, because they say, well, you can't prove that this app really works, because you can't tell us how many red screens have been seen. So maybe we should forbid the app. So it's a very interesting thing. And then the other thing is that the lawyers are panicking. You know, they see an intrusive system, they see a pandemic. They think that, of course, pandemic has been used to abuse power. So, and their response is that, well, we really want to know what's happening, so please describe your system in detail. So I spent the better part of my summer writing dozens of pages of law, which has been approved by 8 parliaments in Belgium, which fully describes every bit of this system, and every key and every hash and every MAC and every commitment is in the law. So I think it's a big mistake, because if we now want to change something, we can't, because we can't change the law anymore. So, but there's this kind of level of trust. The lawyers, they want to know exactly what's happening. And well, if you say, well, high level, we do this and we send beacons, and no, we want to know the exact details, because only then can we really be sure. So instead of checking, we're going to check afterwards what you did and whether your system actually is auditable and is private. They prefer to specify everything in the law and then have it in concrete, and then you can't change it anymore, which I think is a big mistake. So I think that's a lesson I learned, is that we should convince lawyers to stop doing this nonsense. Don't write technology into law. Okay, then. I see you're running a bit out of time, but hopefully I still am not boring you completely. There is actually still a big debate happening, because I think at this moment, it took a while. Well, I think it's already happening for 3-4 months. I think cryptographers have finally understood that we also need presence detection. I mean, it was mentioned before by the doctors and by the epidemiologists, but we were kind of reluctant to do it. So you have to actually have a system where you can know who has been in a restaurant, and then you can warn those people in the restaurant. Okay, this is different from having the app, because, for example, you assume that these aerosols have been circulating and people were 5 meters or 10 meters away. So, but still, because they were in the same restaurant and ventilation may not have been optimal, you may want to know who was in the same restaurant. Also, it's very important for detecting clusters to find out whether infections happen at hairdressers or in restaurants or at football games in the future. So we want to find out. So I don't know what the Austrian system is, but the Belgian system is that restaurants have to have a paper list. And of course, everybody calls himself the mayor of Antwerp in there and gives a random phone number. So it doesn't work. It's also very cumbersome to pick those up. So interestingly, now there is a number of systems that have been proposed. And guess what? Germany and France are pushing. It's interesting now. Germany and France are now in different camps. Germany is publishing a proprietary solution, which is more centralized. France is publishing an open solution, which is a bit less centralized, I would say, but then in practice, you have to put it in the same app, which doesn't work because it doesn't work on iOS. And so the DP2T team has made Card Notifier and is implementing this in several countries. So, but there is still a big debate. And there was a meeting even today at the Commission level. So France is pushing their solution, but most countries have a bit suspicion of what France now proposes in this business. But there is still some research to be done, is how can we do this actually efficiently? Because it's a device and a venue it doesn't have to be as fast. So there is a check-in operation. So the DP2T team actually has proposed a solution with identity-based encryption. So you can use more complex primitives here. But this debate is actually still happening in real time. And so if you want to get engaged, this is still happening full time. It's probably more interesting than proximity tracing because this seems to be the debate for the next month. I think in a month they will decide whether it will be implemented at all and which version will be implemented and whether we have a European solution or not that's compatible. Because at this moment, France, Germany are pushing something that's not compatible, and Belgium and Ireland, we're kind of like the Swiss solution because Switzerland doesn't have a seat in the debate. So there may be solutions that not work together. And finally, vaccination certificates, this is the new debate. So should we have this at all? So Qantas says we need it. Greece, Cyprus and Israel already said we will have one. Cyprus has said to the UK, whatever you produce, we will accept it because we want your tourists. And von der Leyen has said we will have a solution in 3 months before the summer. Okay, so I think there's interesting research questions like, should we really have these things? What about our orange or yellow booklets? Of course, people already propose cryptography, anonymous credentials, zero knowledge proofs, and so on. This is all being proposed. But I guess we should learn from the mistakes. And I think this is also something I should mention for crowd notifier. I think you should probably talk more to health experts and even more to privacy activists. We did talk a lot to those in March, but I guess we still haven't talked enough to the medical world. But so I think that the question is, first, can we do this in a privacy-friendly way? I think that's an interesting question. But I think the other question is, should we really have governments setting bids on us? Because then they can send a bid, you know, has AIDS or doesn't have AIDS, has hepatitis or doesn't have hepatitis, complies with government policies or doesn't comply with government policies, is whatever, has written critical articles about the government, put his trash outside too early or not. I mean, the problem is, should we really roll out a system where the government can set a bid about us? Because once they can do it, they will set maybe many bids about us. And then there is the debate in the Anglo-Saxon world where there is no identification system. I mean, in Belgium or Germany, this debate doesn't exist. I guess also not in Austria, but in UK and US, there is no government identity. So they will have to use biometry to do it. And so the question is, I think it's really an interesting societal debate that's happening right now, and cryptography can play some role because maybe we can come up with good solutions. But the question is, can we set a bid on people? Or should we do this? That's a more broader debate. Should we really do this? Although I guess if you listen to Qantas and Cyprus and Greece, it's already decided. And if we do this, can we avoid that this is being used for many other purposes and become kind of, you know, a way for government to classify all the citizens and actually become something very Orwellian? It sounds very natural, and we all want this bit because we all want to go back to conference notifications. But will we get rid of the system ever? And how can it be abused? I think I spoke too long, but I hope I found some interesting points. So thank you very much for your attention. I'm still happy to take questions. So the main lesson learned is that society is complex, and as cryptographers, if we want to get things rolled out, it's a very complex dialogue you have to do. So securing communications is kind of the easy job. Securing stored data is easy, but if you really want to play a role in society, you have to talk a lot to all the other people to understand how your cryptography fits into the solutions. Okay, happy to take questions if you're not completely bored or have to run to your next meeting.
Okay, thanks Bart for this excellent talk. I really thought I know most about the topic, but there was like lots of new stuff in this presentation. You know, I have lots of questions, but maybe, you know, let's give the floor to everyone else here in the audience. I think most people are still here. Then they have to run for meetings. So I don't know, please just speak up. I don't know, people can't just speak up, right? We don't have to unmute explicitly. Okay, so if there are no questions right now, then maybe I ask the first one. I mean, this is fascinating that people don't upload this, even though those are people actually down, you know, that people don't upload once they are diagnosed. Even those are the people who installed the app in the first place. That's even more surprising. Did you talk with like people from mechanism design or something to find some kind of interesting incentives for them to do it?
Well, I think first, I think that because of time pressure and whatever, I don't think the user testing in Belgium was optimal. So I'm not sure that all the screen, I mean, for example, I never got to see those screens. It took a long time before I got to see those screens. So I think there is improvement possible. Second, I think, so I will know more in a month. So I'm now working with some people who will start a user study in the next weeks. I can say, well, only now, but I mean, we've just been busy all the time, right? It's kind of, and we still think, unfortunately, that this app will be needed for another 6 months. So we hope that by April, we've planned some updates and we hope to improve this. I guess the easier solution would be the German approach and say, if you install the app and you test positive, you commit when you install that you will upload your keys, right? But I find this a little bit, you know, I'm not happy with it. I think actually giving people the option is very important because it's a very different situation, right? You now suddenly are there. I think one suspicion I have is that in Germany or Switzerland, I guess Austria, you call somebody and this person is well trained, they can actually convince you to do it. While in Belgium, you sit there, you get your app, you get this positive test, you say, what? Right? And then maybe your biggest concern is not to go to the next screen. Maybe you throw your phone in the corner or whatever, or maybe start calling somebody up and ranting about or whatever, or maybe, I don't know, maybe it's also psychology that it's maybe not the best time to ask people to make such a decision. Okay. And people have the option to go back, but of course people will not go back unless you prompt them to do it. But so I hope that in a month we'll have an answer, and we have still some plans to fix this in the next few weeks. We have a sprint plan to actually change this mechanism.
Can people selectively upload some days or kick?
That was first foreseen, but we decided to drop that because of complexity. I mean, it's already amazing. In Belgium, if you get tested, you have to push a button. And some people push the button in the weekend, and then they keep this test stays there for a while. And I mean, you can't imagine that, you know, you have a system with 3 buttons and people can still misuse it. So I think in that respect, I'm not so unhappy that we haven't had too many options. But this is completely outside of my area. I have to trust other experts there.
Any questions from the audience? Otherwise, I have another one. So, you know, for the next pandemic, in, you know, maybe something from whatever 2 to 100 years, you will see what would be kind of the main things you would suggest we should do now in terms of maybe hardware or politics, or what's the...
I think it's very hard. I don't think it will be 100 years. That I think if I listen to I talk to a lot of epidemiologists, they think another big one will come sooner than 100 years, given the way we are behaving as human race. I think, of course, the big concern is that I think the medical world was not ready. I mean, we speak of e-health, but in practice, in fact, the medical world is not ready. And I mean, I hear horror stories from Switzerland. We still have things that we faxed. In Belgium, we have a decent system, but I still see the labs have big problems sending data reliably. Okay, so the central database doesn't work at all. So some labs keep sending the same data over and over. The central database can't deal with it. I mean, you would think that like unicity in databases is easy. No, they can't solve it now. Our university hospital is a huge hospital, highly ranked. It has an app. I get everything. I get my consultations, my invoices, my test results. I get everything in this one app, but it's an island, right? So it's a big hospital which has 10 satellite hospitals, and they have a super high-tech app, and everything is integrated. I can see all my pictures and all my appointments and everything I need, but it doesn't cover. They don't want to integrate it in the central database because they hate each other, right? They see each other as whatever. They say, we have to give you data, we never get data back, so we refuse to send you all our nice data. So I hope that in a few years, 5 years, 10 years, we'll have better IT in the health systems that will make it easy to integrate with. So I think in general, there is still this kind of fight against IT in health. So they see the benefit, but nobody wants to give up the power, and there is privacy concerns, and there is concerns of the government trying to find out who makes how much, and maybe the government trying to rebalance income of doctors and so on. So they're very reluctant of them to participate. I think in terms of technology, of course, in 5 years, we all have ultra wideband in our phones. So distance will be much more accurate. So in that sense, it will be a benefit. But I think if the pandemic comes soon and we have those tools, I still think that probably a solution that will be rolled out will be less privacy preserving and will be imposed. That's the way of how society will go. Right? I think if you would have proposed this cafe app a year ago, people would have shouted at you and the DPA would have stopped it. I think if you now propose this location detection, people will, yeah, well, anything I can get to get back to normal, anything is fine.
Bart, I have a question. With regards to the, I'm curious about the vaccine passport. While for corona tracing apps, there are clearly lots of also technical aspects and also privacy aspects related to that. For what is from a technological point of view, kind of the difference between a corona vaccine passport and any type of digital identity, digital passport, whatever, like this you mentioned before, anonymous credentials. So like this seems to be from a technological perspective a story that we have seen already since decades. Is there any specific twist to the corona vaccine passport from a technological or from a societal perspective? What you mentioned makes a lot of sense. Should we limit it in our freedom due to our health conditions? So kind of that's one question. But from a technological perspective,
technology-wise, I think it's trivial. Although it's more tricky. I mean, the Netherlands, I just heard about this, and I think I don't know how public it is, but I don't think it's a big secret. In the Netherlands, you will be able to go to a concert or access certain events if either you're vaccinated or you have in the last 48 hours a test, or 8 weeks ago you had a positive diagnosis. And so they want to process this into one thing. I think technology-wise it's easy, but I think it's a problem how to link it to the person. So in the Netherlands, what they will do is they will put in the QR code your first initial, your last initial, and the day on which you were born. So the day of the month, to kind of avoid that people can give such a thing to somebody else, but it still kind of doesn't give your name. So I think technology, no, there is not much to do, but although maybe with very innovative solutions, we can maybe, for example, make these things expire better or revoke better. But I think as technologists, we should get involved in the debate, point out the risks of these things, right? I think is very important to be present. I mean, I've been going to a few meetings, but after a while I gave up because they can discuss, I mean, if you societal debate or political debate, not societal, political debate, the countries, I think they can argue for half an hour about a single word in a text. Okay, and then you have to write 12 pages. And I have a lot of patience, but there it stopped for me, right? Because it's really, I think all the debates you have in society come together in there. And for example, I mean, one of the debates I just read about in the newspaper is that, for example, one of the debates they're having is Hungary is using the Russian vaccine Sputnik. Will this be also allowed in the European vaccine certificate? No, that's the kind of discussion. There's no technology debate there. But all these things have to be sorted out, right? And so I was amazed. I also thought, I went to my first meeting before Christmas. I thought that we would be done in 2 weeks and document would be done. They still discuss. And so now from the line I said, you're going to be done in 3 months. Otherwise, I'm going to get angry. But I feel a bit powerless because I think it's going to happen anyway, right? So because the pressure is so high of the Mediterranean countries, they want to get again 30 million tourists, and they'll do anything to do this. And then the consequences are for later. I think also I see more panic in countries like UK and US where there is no identity infrastructure, right? I mean, in Belgium, Austria, we have one anyway, so we're not so panicky about it. That's the other thing, of course. But I think the government making statements about our health in the digital form, I think it's more important than you think it is, right? Because think how this can be abused in certain nations.
Absolutely. I think that is the most critical part to discuss, yeah.
Maybe we all get the academic bit, like crazy academic. We get a bit set in our digital passport, crazy academic. That's...
Yeah.
I also have a question.
Oh, sorry.
Please go on.
Okay, I would be interested, you mentioned that there are some ways that the system could be attacked, for example, by setting up a Bluetooth reader with a camera or by using relay attacks. Did you see any evidence of these attacks being mounted in practice, or are you aware of anything in that direction?
I'm not aware of this, no. I think honestly that if you really want to violate privacy, there is much easier ways to do this than putting, I mean, you can as an academic put up an attack and show it works. I think some have done it, right? But I think if you really want to violate privacy, I mean, if you do this, clearly you will get the whole society against you. You probably, if they get caught, you get a very big conviction, right? Because this is clearly, you will get, it's going to be seen as completely unacceptable. So if you really want to violate privacy, I think it's much better to put into trash cans detectors of MAC addresses or something like this, do this kind of experiments, or put cameras out and whatever. I mean, I think in practice, it's a risk analysis, and this was a big debate between centralized and decentralized. I think in terms of risk analysis, I don't think people will do localized attacks with these kind of things. It could happen, but it seems to me not as the highest risk that's there. But for example, something I could stop, in Belgium, there were some people who proposed that to encourage the use of the app, they would in railway stations have a Bluetooth antenna to detect how many people had the app. And I said, please don't do this because people will actually feel caught, right? I mean, it's kind of people will say, oh, the government is putting out a spying infrastructure for the app. So I can see the positive feedback, like, you know, so many 10,000 people in the station came by with the app, but I think also the risk people say, oh, if I have the app, I can be spotted. And so I think the honest answer is, I don't know. I think what I think is that the biggest concern is somebody would bring out an app to actually spy on other apps. And then this app would get 1 million downloads or 100,000 downloads, then you have a problem. But I think if that would happen, I guess what you have to do is stop this app. I mean, go to Google or whatever, or go to the government and say, look, don't do this, guys. I mean, this is. So there is one person who brought out an app to analyze all the data in your app, which I guess is a first step, right? There's nothing wrong with that, but it's a first step. And I mean, then you get scared, right? Because what if the next step is he's going to put out an antenna and all the data which you can pick up with the antenna and whatever. But somehow people lost interest in it, I think.
Okay, thanks.
So yeah, I have also a question. It's a broader question. So you talked about legislators wanting to regulate technology basically too much and put everything into laws before there's room for trying things out and innovation, basically. Yeah, and it's basically a broader topic, and I'm also not an expert on this, but I just want to ask if anyone would agree. So my feeling in general about laws, I feel like the way we do laws and everything today mostly feels like it was done in the past, and I feel like our present has changed so much with technology and all the possibilities that we now have as humankind, that I kind of feel like this entire process, the way we actually do laws, will need to be changed at some point in time, because I feel like it just won't work with such a complex world and all the technologies that will be developed in the next years. And yeah, so I just want to ask if you have any ideas, or if you would agree on these.
I don't know the answer. I think in general, I think the laws should be technology neutral for sure, because it's changing too quickly. But I think what you need is strong enforcement, right? I mean, it's kind of, we're very lucky to have people like Schrems to actually enforce the laws, because the reality is GDPR is a high level law. It's general enough to actually be applicable, but it's just that member states refuse to enforce it, right? But I do believe indeed that, like, I do think that we'll have to have more enforcement, and also especially enforcement of large monopolies. And so, of course, it's very ironic that Google and Facebook and Apple can change their algorithm every day, and the Privacy Commission in Belgium does nothing, or the Irish Privacy Commissioner. But that if you use something which is kind of a very simple functionality, you actually have to specify every bit in advance, and they have to, of course, they don't understand it, but they want to see everything specified. And now they're doing an audit of the system, which I think is good. So they ask what the problems are with the system, which is good. But I mean, they don't do this for Google, right? And so I think the laws may not be the problem. I think it's more the enforcement. I mean, I don't know the numbers, but I think the privacy authorities in Europe, they have several thousand people, but only, I think, a few percent computer scientists. I think that's a very big problem. I think the privacy authority should have each dozens of good computer scientists to actually test tools, who look at websites, who do audits. And I think that would enforce the law that way. I think that writing laws, changing the way laws are written is very, very difficult.
Yeah. Yeah, that's what I kind of feel like. It seems
I mean,
like
we've been doing
basically
this for thousands
impossible
of years.
almost.
We shouldn't change this. We should change the enforcement of the law. The problem is, for example, Parliament no longer understands what's happening because everything moves so fast. The governments have army of technologists, but the privacy authority, the Parliament, the highest court, they stay behind and they don't understand things. I think that's a because you lose your democratic control.
Yeah, for sure. Like we need more experts on these things involved in like making laws, basically.
So for example, something that I think,
them.
something what most of the legal people in the Privacy Commission didn't understand is that you can't use this app to point to somebody and find out this person is positive. Right? This is something that is contact tracing. So if somebody is, somebody positive, the app should tell me. Right? And getting this in their mind that with our app, this is not possible, this is very, very tricky. And I'm quite sure if you test that, half of them still think that this is possible with the app. Right? It's a different way of thinking, right?
So my feeling is right that there's still quite a lot of stuff to be done in these areas to be up to date with these concepts in our world, basically. Yeah. Okay. Thank you.
Okay. Any more questions?